it's Sarah, one of the community midwives. We're just making a short film today just to reassure you and to answer any questions you may have. If we're unable to answer those questions, then please do not hesitate to contact your community midwife.
Should I continue to attend my community midwife appointments as normal?
It is important to attend your routine antenatal appointments with your community midwife. Some of these will be face-to-face appointments and some of them will currently be done via the telephone. If you do have any problems between any appointments, we always advise that you call the triage number with any concerns.
I've got my scan next week. Is my partner allowed to come with me?
Yes, your birth partner can now attend all pregnancy scans with you.
If I haven't shown any symptoms of COVID-19, will the midwife still be wearing PPE?
Every member of staff will be wearing a mask, gown and gloves. This is to keep you, your baby and our staff safe.
If I have concerns about my baby's movements but I don't want to bother the midwives because I think they're busy, what's the best process to follow?
Well, firstly, make sure you're eating and drinking normally. If you haven't eaten recently, have something substantial, a snack or a main meal. Have a nice ice cold drink. Empty your bladder, lay down on your left side with both of your hands on your tummy for up to 2 hours. If you're not happy that you're getting your normal movement pattern, give us a call on the maternity triage and we will give you some further advice.
Should we be thinking about packing anything different or extra in our hospital bags?
Pack your bag as you would normally. Maybe use a wheelie bag if you can, because you'll need to have the staff helping you take your bag home. Don't forget to pack your charger, because you will need to contact people who don't have chargers for your phone.
What happens if I go overdue?
If your pregnancy goes beyond your due date, which is at 40 weeks, then your community midwife will make a personalised plan for you. Now this could include up to 2 suites, membrane suites, which your midwife will explain, and then we'll also arrange an induction for you at the Conquest like we would normally during normal times.
Am I still able to have all the same pain relief options?
Currently, yep, all of the analgesia that has been available before is still available now.
If a woman is showing symptoms of COVID-19 when they're going to labour, what does that delivery look like and how will this affect the baby?
So that will involve the midwife having full PPE, so that involves a mask, face shield, as well as a gown for protection. During labour, the woman will require continuous monitoring. So we can try and for that to be telemetric or wireless, which will enable the woman to move around as much as she would like to. And the amount of monitoring concerning her blood pressure, pulse, temperature, that will be done more frequently on an hourly basis. Once all these are in place, we would hope that labour and delivery should continue as normal as is possible. Following delivery, mom is able to breastfeed. However, we advise that the mother wears a mask to prevent any possibility of transmission after baby is born. The same will apply for if she requires skin to skin.
My partner come into theatre with me if I need a C-section.
Yes, your partner can come into theatres and be with you during your C-section. Whilst you're being prepped for theatre, one of the midwives or the MSWs will take your partner and get him into some scrubs and he will meet you in theatre once you're ready.
If I have a straightforward labour, can I be discharged straight from the labour ward?
Depending on how well you and your baby are, you are able to be discharged straight from the labour ward.
Will I still be able to get breastfeeding support after delivery?
Absolutely. We have trained nursery nurses and maternity support workers on every shift and they will be able to support you with feeding your baby. When you go home, we have community support workers and midwives that can always come out and assist you with your